Welcome! Today we're going to dive into the essential playbook for clinical trials, which you probably know as Good Clinical Practice, or GCP. Specifically, we're looking at the latest R3 update from the ICH. You can really think of this as the global gold standard. It's what makes sure that all our research is both ethically sound and scientifically solid.
You know, at the heart of every single clinical trial is this one fundamental question. It's a real balancing act, isn't it? On one hand, you have an absolute duty to protect the people who volunteer for these studies. And on the other, you've got to generate data that's reliable and high quality. Getting that balance right, well, it's not just important, it's everything.
And that challenge is precisely why the Good Clinical Practice Guidelines even exist. They're not just some dry list of rules. They're a roadmap designed to help all of us navigate that really complex and critical intersection between keeping people safe and pushing science forward.
And the guidelines are crystal clear about which side of that balance always wins. This principle, which comes straight from the Declaration of Helsinki, is the bedrock of it all. The rights, safety, and well-being of the participant always come first. Period. Everything else flows from that single powerful idea.
Okay, so that's a great ideal, but how do we actually put it into practice? Well, the answer lies in these 11 guiding principles. And this is a big but, don't think of them as a rigid one-size-fits-all set of regulations. It's much smarter than that. Think of it as a flexible framework you can adapt to any kind of trial, from the simplest to the most complex.
And here's something that's absolutely crucial to understand. These 11 principles are a package deal. They're designed to work together. You can't just cherry-pick the ones you like. For this whole system to work, you have to see them and apply them as one cohesive whole.
And this visual here gives you a really good feel for what I'm talking about. See how they all orbit that central goal? Each one is a piece of the puzzle, and they all support each other to create this really robust system that ensures quality, safety, and results you can actually trust.
So to make this all a little easier to digest, we're going to group these 11 principles into 3 main themes. First, protecting participants. Second, ensuring the integrity of the science. And third, a really modern idea, building quality into the trial right from the very start.
So let's start with the absolute foundation, the bedrock of any clinical trial, protecting the participants. These are the non-negotiables. They're all about safeguarding the very people who make this research possible in the first place.
Now, 3 key principles make up this ethical bedrock. First, as we've said, the trial has to follow the principles of the Declaration of Helsinki. Second, informed consent is king. It has to be completely voluntary, and the person has to totally understand what they're signing up for. And third, you need an independent review from an IRB or an IEC before the trial can even start. It's a critical layer of unbiased oversight.
Okay, so with that ethical foundation locked in place, the next group of principles zooms in on the scientific integrity of the trial. If you think of ethics as the why we do this, these principles are the how we do it right, so the results are actually meaningful and trustworthy.
This next bucket is all about scientific rigor. For starters, the trial itself has to be based on sound science, not just a hunch. The people running it, they've got to be qualified and properly trained for their roles. You absolutely need a clear, detailed protocol. That's your blueprint, and everyone's responsibilities have to be documented. The investigational product needs to meet manufacturing standards, or GMP. And look, all of these things work together for one big reason: to make sure the data we get is solid, leading to reliable results.
Our third and final theme really gets at a major shift in this new R3 update. It's a move toward a much more modern, proactive way of thinking about quality. This is a huge evolution from just, ticking boxes for compliance.
The big idea here is something called quality by design. It's all about shifting from a reactive mindset to a proactive one. So instead of waiting for problems to happen and then scrambling to fix them, this approach says, hey, let's think ahead. What's really critical to participant safety and data quality? And let's design the trial to manage those risks from day one.
And that leads us to a super practical related idea, risk proportionality. The concept is simple, really. The amount of oversight you have should match the amount of risk. So for example, a trial with a really subjective endpoint, well, that's riskier, right? So it's going to need way more monitoring and training. But a trial testing a new use for a drug that's already approved, that's lower risk, so it needs less intensive oversight. It's just about being smart and tailoring your approach.
So how does all of this come together in the real world? Well, the key thing to remember is that this isn't just a simple checklist you tick off. It's a dynamic, interconnected framework for doing clinical trials that are both scientifically effective and deeply responsible.
And I know I've said it before, but it's so important it absolutely bears repeating. These 11 principles are not isolated rules. They're woven together. For example, you can't really protect participants if your data isn't reliable, and you can't do either of those without a proactive quality by design approach. To be effective, you've got to see it and use it as a single, cohesive system.
And that really brings us to the whole point of this. It's not about memorizing a list of principles. It's about putting them into practice. So the question I want to leave you with is this: how can you take this entire framework and proactively build it into your own trial designs right from the very beginning?